morning, John Jordi again from Dear John. Want to follow up about compression and something a little different. That would be chronic venous insufficiency. Let me give you an example of one patient that I have. The reason he came in the clinic is that the swelling was happening so fast, it was getting in the way of his job as a police officer, also his vacation that he was down on the beach. He could not even walk a couple blocks before he was considering getting a wheelchair or calling an ambulance. The swelling was building up from the morning to mid-afternoon to by late afternoon. He simply could not walk any longer. The pain, the fullness, and the volume was too much for him. So what do? Well, we treat him. We get the volume down and we treat also the veins. But he's always going to need compression because the veins might be fixed with different procedures, but the problem is that the lymphatics don't get fixed. He's going to need compression all the time because the lymphatics are now fatigued to the point where they don't come back. And he has what we would call a secondary lymphedema. Untreated veins lead to more and more problems. You start seeing more tissue damage, tissue changes, wounds. These patients need compression all the time. Don't let your legs get bad. There's nothing like having swollen legs that never get better. If you're thinking about it already, I would tell you what, probably time to get your socks on and look at quality compression socks. They make all the difference in the world. If you're wondering about that, look at my last video. Again, thanks for joining me. Thank you for your questions. We'll keep answering them and we'll keep posting. Look forward to seeing you on the next Dear John. Dear John.